My name is Jillian Coves, and I decided to do my final project on psoriasis in modern nursing. So what is psoriasis? Psoriasis is an autoimmune disease where your skin has increased cell growth. In people without psoriasis, the skin will grow and shed within 1 month. In people with psoriasis, the skin will grow in about 3 to 4 days but not shed. This will cause raised red patches on the skin that are often itchy, painful, and burn. So some nursing considerations we need to think of. Um, with psoriatic arthritis, well, what is that? There are patients who have psoriasis but also have psoriatic arthritis. This type of arthritis only occurs in patients with psoriasis. Psoriatic arthritis is when your immune system attacks healthy connective tissue in your joints, causing inflammation. The onset of psoriatic arthritis can occur at the same time as psoriasis. However, the onset of psoriatic arthritis is usually years after your initial psoriasis diagnosis. So one thing we need to think about is with ADLs. How is this affected? So the pain in your joints associated with psoriatic arthritis makes it hard to ambulate. And also the constant itching from the raised red itchy patches on your skin. All you do is itch all day constantly, and it does interfere with your daily life. And also, we need to think of self-image and confidence in these patients. Patients may have impaired skin, and they may feel different than those without psoriasis. This is just a picture of psoriasis on the forearms. So how does psoriasis impact politics and society? In patients with psoriasis, overall productivity decreases 10% due to the debilitating factors of the disease, such as decreased self-esteem and chronic itching. Patients with psoriasis take an additional 3 sick days per year versus someone without psoriasis. And many patients often have lower self-esteem and face discriminations from those without psoriasis. So what are some legal and ethical concerns? So one thing I learned while researching this project is something called step therapy. Step therapy is also known as failed first treatment. So step therapy makes the patient try the insurance's preferred treatment regimen before starting a treatment the doctor prescribes. So now how is this a problem to patients with chronic diseases like psoriasis? So step therapy is a one-size-fits-all treatment regimen. It is what the insurance company wants to treat the patient with first. It does not consider the patient's needs and the previous treatments the patient has tried before. Additionally, if the insurance's preferred treatment is something that the patient knows that it does not work for them, the patient may not adhere to it because it is a potential waste of time and money. If the patient were able to start the doctor's preferred treatment method, the patient can find comfort and relief faster in their psoriasis. So recently, in 2020, North Carolina passed a law making it so that insurance companies have to have a clear path for patients to exempt step therapy. So a direct quote I found online is, this new law requires insurances to provide a clear process for submitting an exception request to step therapy protocols if the required therapy will likely cause an adverse reaction, is expected to be ineffective, or if the patient has previously tried it. Insurances are required to respond to a step therapy exception request within 72 hours or 24 hours in the case of an urgent request. So some innovation in psoriasis. For the treatment of psoriasis, topical creams, corticosteroids, phototherapy, and immunosuppressants are always a classic choice in treating psoriasis. Innovation has provided many new treatment options, however, the cost of these treatment options are very high. So always it's a positive to find new medicines for patients with psoriasis, but it's a negative that the cost of these are very high. So the real clinical impact of these medications are biologic. So what biologic is a medication that is able to target specific parts of the immune system that are overactive because of psoriasis. This eliminates many side effects of the body, such as the kidneys. Many patients who are on Medicare have psoriasis have difficulty affording specialty medications such as biologics. Treatment options like biologics have high out-of-pocket costs due to pharmaceutical companies raising prices and reliance on co-insurances. So for some of us to have Medicare, they would rely on another additional or secondary insurance to cover the rest of certain medication. For example, Skyrizi is a biologic injection used to treat moderate to severe psoriasis. The manufacturer price per injection is $21,017.36. Now, I find that pretty expensive. And in South Carolina in particular, 22% of residents are on Medicare. In this situation, a South Carolina resident who needs Skyrizi for their psoriasis may have extreme difficulty in obtaining this medication. The final cost dependent on the patient's insurance coverage. So, for example, if someone, even with Medicaid, was to have something like psoriasis, they would have extreme difficulty affording a medication like Skyrizi because of just of how expensive it is. And if they were only on Medicaid and didn't have any other secondary insurance, it would be very hard for them to afford this medicine. Here is just a picture of Skyrizi and the little vial that it comes in. But now, when I was doing my research, it does even come in pens that the patient can self-inject. And usually these patients get these injections about once a month. So a potential clinical impact, patients who have psoriasis may have something called the Koebner phenomenon with surgery, or just any sort of skin trauma in general. The Koebner phenomenon is when trauma to the skin causes a new lesion to appear on different parts of the body. So in conditions like psoriasis, that can also happen in other conditions like warts or even Lyme disease. However, there is not enough evidence to support the Koebner phenomenon. But as nurses, we must continue to check the patient's uh, skin and for any sort of deviations in integrity. And why is this such an issue, for example, in a setting of the operating room? So in the operating room, skin is a big issue. So, surgeons make surgical incisions, we move skin, we put skin grafts on. There's also a potential for the patient to be on an operating room table for hours at a time. So we need to make sure and document what the patient's skin looks like before, during, and after surgery. Not just the surgical site, but also the skin surrounding the surgical site and the patient's body. So addressing the issues. So one thing we can do is look at the cost of medications. Yes, I've hit on that medication can be very expensive, especially something like biologics. But one thing we can offer is like copay cards. Copay cards are coupons from the drug manufacturing company that offer discounts on certain medications. So if you see something like GoodRx that also have like coupons, you can save money on some certain prescriptions. Um, and also some healthcare organizations offer patient financial assistance programs. So where I work at my facility, they do offer a lot of patient financial assistance programs. I've seen in pre-op when I go see a patient, like the business office comes and talks to the patient and sees if they need any sort of like financial assistance with certain procedures or treatments. And also another option a patient could think of is doing a clinical trial for a new medication. So, for example, before Skyrizi even came out, a patient could have been part of that, with psoriasis, could have been a part of that drug trial to see if that medication was to work. And then, for example, with the Koebner phenomenon, you can't prevent getting the Koebner phenomenon, but you can reduce your risk of it by managing your psoriasis correctly and preventing trauma to your skin. Now, you can't prevent having surgery. That's different, but also if you just make sure you take care of your skin, prevent any sort of additional trauma like any bumps and bruises, you can help prevent this. And here's an example of a copay card that I found online. It's not for any sort of specific medication related to psoriasis, it's just an example. In conclusion, psoriasis is a chronic autoimmune disease that affects patients in physical and emotional aspects. If I was a patient and I had psoriasis, I uh, would suffer greatly from the physical and emotional aspects. Just having those skin lesions, I would feel very self-conscious. Um, the cost of treatment is very high. However, there are options like to reduce costs, such as being a part of a clinical trial, um, talking with your healthcare facility about any sort of financial assistance, and also getting a copay card from a drug manufacturer. And also sometimes at doctor offices, they do have samples of certain medications. And then as nurses, we must be up to date on current resources for patients with chronic diseases like psoriasis. And here are my references.